everyone. I am Dr. Priyanka Sachdev here, NEET PG educator on Unacademy. Today I am here to discuss a new series with you people, that is most probable MCQs for NEET PG. We all know that NEET PG is about to come and we have to revise more and more MCQs. Before that we have to be prepared for it. So today I am launching a new series for it. For pharmacology, we know that pharmacology is a difficult subject and many questions, about 25 to 30 questions in NEET PG are going to come from pharmacology. So here daily we will take one topic from pharmacology and we will discuss most important probable MCQs which can come in your NEET PG 2021. Now the first topic for today is pharmacokinetics. So daily I will take one topic, one system, first from the general and then from system wise, one by one we will take the system. And before your NEET PG, I will try in the next few days, in 5-6 days I will cover to wrap up this series, and I will launch daily one system and most probable MCQs. So I will cover repeat MCQs also and new MCQs also. For repeat MCQs, I will take MCQs from the past 3-year papers, 3-year questions from NEET PG, FMG and INICT, because any exam question can come in your exam. FMG and INICT aims, and all the questions will be covered in the repeat ones, past 3-year papers from that particular topic. So today's topic is pharmacokinetics of the general pathology. So we will cover all MCQs from this topic and new MCQs. I have framed some new MCQs also based on these topics, these questions only. So how new MCQs can come in your exam. We know that 50% questions are new and 50% questions are repeat. So for repeat also I will prepare you, and for new also I will prepare you. So let's start. Now some questions are very easy. I will start with easy ones. First few questions, 1-2 questions are easy. Then we will increase the level of difficulty. So just listen. So this is the first question in front of you. Pharmacokinetics includes studies of all except. Now please mind, the question contains except. Don't miss except in your questions in MCQs. Most of the students, they are in rush and jaldi mein they forget to read the except, and in excitement they mark the option without reading except in the question. So question contains except. Your options are absorption, distribution, adverse effects and excretion. So for attempting this question, you should know what is pharmacokinetics and what is pharmacodynamics. So yes, you can always have a guess. What is the correct answer? Yes, most of you are correct. The correct answer here is C. The correct answer here is C. Now I will give you explanation after each question. So this is the explanation. We know that in pharmacology, we have two branches, pharmacokinetics and pharmacodynamics. What is pharmacokinetics? What is pharmacodynamics? What the drug does to the body. What the drug does to the body. I am taking a tablet by oral route. I am taking any medicine by any route, by oral route, by intramuscular route, subcutaneous route, intraarterial, intravenous, any route. The medicine, the drug is going inside the body. What the drug is doing after going inside the body, that is pharmacodynamic. Dynamic. It will show its mechanism of action. So mechanism of action of the drugs will come here. So all mechanism of action of the drug, physiological and chemical effects, and the mechanism of action of the drug. If I am having a headache, I am taking a tablet for it, I am taking any NSAID, pain anywhere in the body, that medicine will go inside the body and treat that pain, that reduce that pain. That is the mechanism of action. What the drug is doing to the body. If I am having diarrhea, I will take a medicine that will reduce peristalsis. If I am having constipation, I will take a medicine that will increase peristalsis. If I am having vomiting, I will take a tablet to reduce it. So that what the drug is doing to the body, that is pharmacodynamics. But what the body is doing to the drug, it is pharmacokinetics. Pharmacokinetics means what the body is doing the drug. So as soon as I take the medicine or drug by any route, just suppose most common route is oral. I am taking a tablet. So first it has to be absorbed. So first it has to be absorbed from the intestine, from the stomach, from the intestine and the stomach. So this is the medicine I am taking. This is the drug. You can see it is going in the esophagus. It is going in the stomach. It is going in the intestine. From stomach or intestine, it is absorbed depending whether the drug is acidic or basic. Acidic drugs are absorbed from stomach in acidic medium. Basic drugs are absorbed from intestine by basic medium. So all the drugs will reach in the blood. So this step is known as absorption. After absorption, it will go to its site of action. So this step, after absorption, it will go to its site of absorption. It is known as distribution. So distribution means it is going to its site of action and it will show its action. That is distribution. So first step is absorption from GIT to blood. Second is distribution from blood to the site of action. It can be brain, it can be intestine, depending what is the disease. So this is distribution. After distribution, last step is excretion. It has to be excreted out of the body via urine, via kidney. Most common route is urine only. But only polar drugs can be excreted in urine, which are soluble in water. So first you have to make your drug from non-polar to polar. So for converting your drug from non-polar to polar, metabolism has to be done. Metabolism takes place in liver. So the third step is metabolism and last step is excretion. So these are the 4 steps of pharmacokinetics. So body is first absorbing the drug from GIT to blood. Then it is distributing the drug from blood to the site of action. Then it is doing metabolism of the drug in the liver. Then it is doing excretion of the drug in the kidney. So the mnemonic is, just a second, the mnemonic is ADME: absorption, distribution, metabolism and excretion. These are the 4 parts of pharmacokinetics, and pharmacodynamics include only one thing, that is mechanism of action of the drug. So that is the two branches in pharmacology: pharmacodynamics and kinetics. Dynamics means what the drug is doing to the body, that is mechanism of action. Pharmacokinetics is what the body is doing to the drug, that is first absorption, then distribution, then metabolism, then excretion. Now try the question again. You will get the answer very easily. This is the question. So pharmacokinetics, try it out everyone. Pharmacokinetics is the study of all except pharmacokinetics. The mnemonic is ADME. So absorption is there, distribution is there, excretion is there, but adverse effects is not there, metabolism is there. So the correct answer here is C. Now the next question based on the same concept, you can answer it. Pharmacodynamics include. What is your correct answer from ABCD? Drug elimination, drug excretion, drug absorption, or mechanism of action. I'm asking about pharmacodynamics, not kinetics. Kinetics, yes, most of you are correct. You can have your guesses. The correct answer here is, of course, very easy question, D. So pharmacodynamics is what the drug is doing to the body. So only one thing here it is included, that is mechanism of action. Absorption and excretion elimination, one and the same thing. Absorption, ADME. Absorption and excretion elimination is included in pharmacokinetics, not dynamics. So correct answer here is D. D. This is the next question in front of you. Pharmacodynamics deals with same question with different options. Effect of drug on body, effect of body on drug, or absorption of drug or metabolism of drug. Pharmacodynamics I am asking. Pharmacodynamics, not kinetics. So dynamics, yes, most of you are correct. What the drug is doing to the body. So the correct answer here is A. The correct answer here is A. What the drug is doing to the body. So correct answer here is A. You got the concept. So all the questions based on this is done. My next topic on which I am going to launch MCQs is acidic and basic drugs. Many confusing questions MCQs come from this topic. So acidic drugs absorb कहाँ से होती है, excrete कहाँ से होती है, basic drugs absorb कहाँ से होती है, excrete कहाँ से होती है. So I will give you the thumbs up rule here. So let's try. Acidic drugs are ionized at which medium? Acidic drugs are ionized at which medium? Alkaline medium, acidic medium, neutral medium, or none? What is your answer? So acidic drugs are ionized at. So yes, the correct answer is alkaline medium. Now why? Now let me try to understand. It is difficult, but I will try my best to make you understand. So for this you have to understand the ionization of the drug. You have to understand ionization of the drugs. Now understand drugs are of two types, non-electrolytes and electrolytes. Electrolytes again of two types, strong and weak. So drugs are of two types, non-electrolyte drugs and electrolyte drugs. Non-electrolytes do not ionize, so no problem. Electrolyte drugs ionize. Electrolyte drugs ionize. The electrolytes again of two types, strong electrolytes, weak electrolytes. Strong electrolytes 100% ionize. They ionize 100%. Weak electrolytes partially ionize. Partially ionize. So my problem is not strong electrolytes, but weak electrolytes which partially ionize. Most of the drugs fall in this category. Most of the drugs are weak electrolytes, so they partially ionize. And their ionization depends on pH of the medium. Now here comes the role of pH. Here comes the role of the pH. Most of the drugs are weak electrolytes. That's why their ionization is partial. Now how much of the drug is ionized and how much is not ionized, it depends on the pH of the medium. Now ionization, let's assume there are two type of drugs. The two type of drugs, weak electrolytes kahan gaya? So weak electrolytes also there are two type of drugs, weak acids and weak bases. Just assume the drug is weak acid. The drug is a weak acid. So acids, you know, HCl, HNO3, H2SO4. So H, proton is always there in acid. So Ha is my acid. Just suppose the example is from KDT. So you can see HA. A can be Cl, can be NO3, can be SO4. So Ha is my acid. So it will ionize like H positive and A negative, H positive, Cl negative, H positive, HNO3 negative, H positive, SO4 negative. So whatever A is. So H positive, A negative. So here drug is A. A is the drug. H the proton. What is the drug here? The drug is A. So A is present in two forms. This is ionized form. A negative is ionized form of drug. And this is unionized. HA is unionized form of the drug. So this is unionized, non-ionized, and this is ionized form. And learn the thumb rule. Ionized drug is excreted, unionized is absorbed. Ionized, once it's split, it ionized, it has to be excreted out of the body. And if it is not ionized, it is complete, it is not ionized, it is unionized, it will be absorbed. So just learn the thumb rule. You have to learn the thumb rule. What is the thumb rule saying here? The thumb rule is that two type of drugs, ionized and unionized. Ionized means splitted, that is A negative, and unionized means complete drug, that is HA. It is not splitted. Ionized drugs are excreted out of the body. Please learn it. Excreted out of the body. You have to learn it. There is nothing to understand. And unionized drugs are absorbed from the body. Learn this golden rule. This is a golden rule, thumb rule, whatever you say. Learn it. Now I will apply it. Now let's take an acid. I will teach you about the pH. Let's take a acid. The acid is HA. Now what is the formula of pH in chemistry you have seen? pH is equal to pKa plus log of ionized form upon unionized form. So this is the formula. Let me write it again. Okay, so pH is equal to pKa plus logarithm of ionized form, that is A negative, upon unionized form that is HA. So okay, so this is the formula. You can see. What is pKa here? pKa is a constant. Can anyone define pKa? It is dissociation constant. What is pKa? If these two values are equal to each other, they will cancel out. A and HA, ionized, unionized, equal 50-50%. So total 100 में से 50% remains unionized and 50% is ionized. So this 50-50 cancel out. So log 1 is 0. We know logarithm of 1 is equal to 0. So this term will become 0. So pH is equal to pKa. So I can say pKa is equal to pH when the drug is 50% ionized. At that point, ionized and unionized will cancel each other. This value will become 1 and log 1 is equal to 0. So pH is equal to pKa. Done. So have you got it? Now let me tell you about the pH, acidic and basic. Let me consider my drug is acid. पूरा उल्टा करूंगी मैं alkaline में. My drug is HA. My drug is acidic. Done. And this is the formula. The formula is in front of you. Now neutral pH is 7. If I increase the pH by 1, it will be alkaline. And if I decrease the pH by 1, it will be acidic. So 7 से या तो 1 बढ़ेगा 8 हो जाएगा, या तो 1 कम होके it will be 6. So medium can be alkaline and acidic. So when I increase pH by 1, the medium will become alkaline. If I decrease pH by 1, the medium will become acidic. First understand that. How I increase or decrease? How? So if I want to increase, now pH is equal to pK when drug is 50-50 ionized. 50-50 ionized, so pH is equal to pK. I want to increase it 1. So this term should be plus 1. This whole term should be plus 1. So logarithm of 10 is 1 ना. We know इसको 1 लाना है तो हमें क्या करना पड़ेगा? log 10 upon 1. log 10, इसको 10 रख दे और इसको 1 रख दे, तो logarithm of 10 upon 1 is equal to plus 1. Then this whole term will become 1. So pH is equal to pKa plus 1 हो जाएगा. Plus 1. So 10 upon 1. 10 means numerator is ionized and denominator is unionized. So ionized drug is more than unionized. It is 10 times more than unionized. So here, if I am doing the medium alkaline, then ionized drug is increasing. That is, drug will be excreted out of the body. If means if an acidic drug is having alkaline medium, then ionized form will be more and it will be excreted more. Unionized form will be less, it will be absorbed less. This is the golden rule in alkaline medium. Reverse will happen for acidic. Acidic, I have to decrease it by 1. In acidic, I have to decrease it by 1. For decreasing it by 1, this term should be minus 1. This term. So minus 1 by 10. Logarithm of 1 by 10 is minus 1. So 1 by 10, numerator is 1, denominator is 10. Numerator is ionized and denominator is unionized. So here unionized is more than ionized. So if an acidic drug is placed in acidic medium, it will remain unionized and it will be absorbed. So that is the summary. No need to understand all these. So learn the golden rules. 4 lines. intestines. Acidic drugs are absorbed. Acidic drugs are absorbed in acidic medium, and acidic drugs are excreted in basic medium. Because acidic drugs are unionized in acidic medium, that's why they are absorbed, and they are ionized in basic medium, that's why they are excreted. We know that unionized form is absorbed and ionized is excreted. The same is applicable with basic. Basic are absorbed in basic medium and basic are excreted in acidic. If you still have confusion, please write it down like this. In the same medium, drug is absorbed. Drug is absorbed in the same medium, and in opposite medium, drug is excreted. Learn this golden rule. Again, I will apply it. Just learn it. If you understood the whole theory, it's good. If you don't understood, don't worry. Same medium, drug is absorbed. So acidic drug is absorbed in acidic medium and basic drug is absorbed in basic medium. Stomach has acidic medium. Small intestine and intestine have basic medium. So acidic drugs are absorbed from stomach and basic drugs are absorbed from intestine, because acidic drugs are absorbed from acidic medium and basic drugs are absorbed from basic medium. That was the absorption. Coming on excretion now. Excretion now. Excretion ke liye acidic drugs are excreted in basic medium and basic drugs are excreted in acidic medium. So if an acidic drug is there, there is a poisoning case. There is a young boy who has ingested poison. So, or too much of any drug, or he has tried to commit suicide by ingesting some poison. I'm a doctor. I want to save the child. The relatives are there. Parents want to save the child, and I am a doctor there. So I will see what the poison is. Poison is acidic drug or basic drug. Just suppose boy has ingested aspirin or boy has ingested barbiturate. So barbiturate is a basic drug, aspirin is an acidic drug. So depending on what drug the boy has ingested, so I want the drug to be excreted out of the body so that boy can be saved. In this scenario, I don't want absorption. I want excretion. Yes. So I will alkalinize or basify the urine. I can do two things. I can basify the urine and I can acidify the urine. So if the drug is acidic, I want the drug to be excreted. I need the medium basic. So I will basify the urine of the boy, of the child, so that drug is excreted. And if the drug is basic, I will acidify the urine so that drug is excreted out of the body. Give me a thumbs up if you got it. Give me a thumbs up. So these are the golden rules. Acidic drugs are absorbed from acidic medium and excreted from basic medium. Again, write the summary. Write the summary. Two summaries. Write it down. Acidic drug and basic drug. Everyone, I will give you 10 MCQs based on this concept and you have to do it correctly. Everyone. Acidic drug, basic drug. Just a second. Acidic drugs absorbed in which medium? Excreted in which medium? Basic drugs absorbed in which medium? Excreted in which medium? Who will tell me? Acidic drugs absorbed in same medium, that is acidic medium. Absorption हमेशा same medium में होता है. Basic drugs absorbed in same medium, that is basic medium. Absorption is in same. Acidic will be absorbed in acidic and basic will be absorbed in basic. Coming on excretion. Excretion occurs in opposite medium. So acidic drugs are excreted in basic medium, acidic, and basic drugs are excreted in acidic medium. So you have to acidify or basify the urine. Give me a thumbs up if you got it. That was a very big concept today I have given to you. So same table it is showing. So acidic drugs are absorbed from stomach because stomach have acidic medium. So example of acidic drug, as I have told you, aspirin. So too much aspirin is ingested. You want the absorption of aspirin. It will occur from stomach. And basic drugs like atropine will be absorbed from intestine. So that is the absorption or excretion. I have told you acidic drugs are excreted in basic urine and basic drugs are excreted faster in acidic urine. So you can acidify or basify the urine accordingly depending what drug it is. So this is the golden rule. This is the MCQ in front of you based on same concept. Now see the MCQ. You will be able to solve it. Please see the MCQ. Everyone, please see the MCQ. You will be able to solve it now. What is the MCQ? About acidic drug. What is true about acidic drug? Which statement? Read the fourth statement. It is best absorbed in acidic medium. Is it true? Is it best absorbed in alkaline medium? Is it true? It is not absorbed in acidic medium. Is it true? Or it binds to alpha glycoprotein. Is it true? I have told you about absorption. Same medium is required. So acidic drugs absorbed in acidic medium. This statement is true. So correct is A, as I have already told you. So acidic drugs are absorbed in acidic medium. This is correct. Rest three options are not correct. See rest of the three options. Best absorbed in alkaline? No. Not absorbed in acidic? No. Acidic में तो होगा. Alpha glycoprotein को bind नहीं होगा. Acidic drugs are bind to albumin, not albumin. Basic drugs bind to alpha glycoprotein. We know it. So correct answer here is A. This is the next question based on same concept. Please try your luck, try it out, try your knowledge as well as luck. So acetyl salicylate means aspirin and phenobarbitone. Both of these, aspirin and phenobarbitone, they are better absorbed in stomach, not in intestine. Why? What is the reason? Read the 4 options. Why they are better absorbed in stomach? The 4 options are in front of you. Because these are weak acids and they remain non-ionized in gastric pH, or these are weak acids and they remain ionic in gastric pH. These are strong acids or weak bases. See the 4 options. Very confusing. Very confusing. It is a new question. It can come in your exam anytime. Very confusing question. So first tell me whether these are, since they are absorbed from stomach, acidic medium. It is given in the question. In acidic medium, stomach has acidic medium. They are absorbed in acidic medium. So these 2 drugs are acidic. So acidic तो है ही. These are not basic. So remove D option. और weak acid है, strong acid नहीं है. Remove C also. अब A और B में से just say what will be the correct answer from A and B. So weak acids are there. So in gastric pH they will be ionic or non-ionic. We have to do the absorption. Absorption non-ionic form का होता है. Ionic form का excretion होता है. Unionized form is absorbed, golden rule, and ionized form is excreted. You want absorption. So correct answer is A, not B. So this is how you have to approach this question. I hope you got it. I hope you got it. This is the next question in front of you. Alkalinization, yani basification. Basification of urine is done for which drugs? You want to excrete which drugs in urine? In which poisoning? There are 4 patients, A, B, C, D, poisoning cases in front of you. So strong acid poisoning, weak acid poisoning, weak base poisoning, strong acid, strong base. So strong is not dependent on pH. So ionization of strong drugs are not, strong electrolytes not dependent on pH. So strong की तो दोनों option हटा दो. Coming on weak. Now weak acids will be excreted in alkaline urine or weak bases. Excretion occurs in opposite medium. This is a rule. Absorption occurs in same medium and excretion occurs in opposite medium. So you want alkalinization means basification for acidic drugs. Alkalinization का मतलब होता है basification. You want it for acidic drugs. So weak acids is the option here. So correct answer here is A. Have you got it? Have you got it? This is the next question in front of you. A highly ionized drug. What is true about it? A highly ionized drug. A highly ionized drug. Is it mainly excreted by the kidney? Can cross placenta barrier? Well absorbed from the intestine or accumulates in the lipid? A highly ionized drug. The drug is ionized. So what will happen? What is the correct answer here? Yes, the correct answer will be A. It will be mainly excreted by the kidney. It is highly ionized. So maybe it is a strong electrolyte. Done. So yeah. Based on next concept. So next concept is bioavailability. Many MCQs in your exams, so all exams come on bioavailability. So very important topic for NEET PG. So bioavailability is defined as, what is the correct answer? From A, B, C or D? So what is bioavailability? I'm giving you a few seconds, 10 seconds to attempt the answer. Any guesses? Any guesses? Yes. What is bioavailability? Any one of you? What is bioavailability? Yes, the correct answer here is B. It is the percentage of the drug that is detected in systemic circulation after administration. So let me tell you what it is. What is bioavailability? As I have told you, if any tablet, if any drug is taken by me by oral route is in the form of tablets I take. So most common route is oral route. So if any drug I am taking by oral route via mouth, it is going in the mouth, esophagus, stomach and intestine. Just now I have told you acidic drugs are absorbed from stomach and basic drugs are absorbed from intestine. Ultimately, drug is reaching in the blood. Drug is reaching in the blood. Now, just suppose I am taking a tablet of paracetamol. I have taken 500 milligrams of paracetamol. So, how much paracetamol is reaching in my blood? Out of 500. It is not necessary 500 ka 500 blood mein jayega. How much is reaching? So, maybe 400, 300, maybe 100. So, what is the percentage of original drug which you are taking by mouth is reaching in systemic circulation? That percentage is bioavailability. If out of 500 only 250 is remaining, so it is reaching, it is 250. So that is bioavailability. It is the fraction of administered dose that reaches the systemic circulation in unchanged form. So that is the definition of bioavailability. So whatever drug you are taking, so that is reaching in systemic circulation. If you are taking it by oral route, it is never 100%. Some of the drug is lost in absorption and some of the drug is lost in first pass metabolism via liver. So whatever drug you are taking, first it will go to liver, then via heart it will come to the systemic circulation. Yes or no? So it will be metabolized in the liver. So it is never 100% for oral route. But for IV, if you are directly giving injection, this is the drug directly giving IV injection. So it will directly reach my blood. So 100 milligram, all 100 milligram, 500 milligram, all 500 milligram. So bioavailability is 100% for IV route, but never 100% for oral route. For oral route, it is always less than 100 because of two reasons. Number one, absorption is never complete, and first pass metabolism for some drugs. So that is the thing. So bioavailability for various routes, it is different. For IV, it is 100. For all other routes, intramuscular, subcutaneous, oral, rectal, transdermal, it is less than 100. For IV, it is 100. Never forget, never forget. Now, how you will calculate bioavailability? You have to make a graph between two things. On the y-axis, take time. This is y-axis, take time. And on x-axis, take plasma concentration and plasma concentration of the drug inside plasma. So make a graph of it. Make a graph out of it. So time always on y-axis, and on x-axis, it is plasma concentration. So this graph, the graph which is obtained, the area, calculate the area. It is a triangle, so half into base into height, whatever the shape it is. So the area under this graph will give you the value of bioavailability mathematically. So how much is the bioavailability of a drug? You have to make a graph. This is known as AUC, area under curve. And curve is made between two things, between time and plasma concentration. So what you have to do, you have to take time on y-axis, you have to take plasma concentration on x-axis, you have to make a graph between them, and area under curve AUC will give you the value of bioavailability. All these are important MCQs. Now two curves are there. I will draw with separate color. Can you see this curve? This curve is the same drug when given by oral route. Oral route diya to this is the curve. You can see the area under it. This is the curve. You can see the curve. Yes. So this is the first curve by oral route. Now the same drug is given by IV route. So this is the curve. This is the curve when same drug is given by IV route. So this is the IV route. Same drug is given by IV route when same drug. So which area is more? It is grossly visible. IV wala more is than oral. So IV bioavailability always greater than oral. This proves. So that was about the bioavailability. Now there are some drugs which have same composition. Just suppose I ask the patient to take paracetamol. Patient is having fever or pain somewhere. I'm asking the patient to take paracetamol. Now paracetamol, there are various brands for paracetamol. Various brands. Paracetamol comes in a brand name of Crocin. Crocin is the brand name. Paracetamol comes in the brand name of Calpol. Paracetamol comes in the brand name of Dolo. So many companies make paracetamol in the same. All of them contains 500 milligram of the paracetamol. Yes or no? So if it is not necessary that all the brands have same bioavailability, it is written 500, 500, 500. So 500 is present in the tablet of each of them. But when the patient, three patients are there, patient A, B, C. Patient A is taking Crocin 500, B is taking Calpol 500, C is taking Dolo 500. So it is not necessary in the blood of these patients same drug the proportion is reaching. So bioavailability of each of them is different, although composition is same. Have you got it? So the drugs are known as biological inequivalent if the difference in bioavailability between the two variants is more than 20%. So same example, phenytoin is given in KDT. So phenytoin tablet comes in the name of Dilantin also, Aptoin also. But if you compare the bioavailability, it can be different, it can be same. So if the bioavailability difference between two brands is less than 20, they are considered bioequivalent. If it is more than 20, they are bioinequivalent. Have you got it? Have you got it? That was about it. Now the next question, again on bioavailability, try it out. You will be able to solve it. Try it out. All of the following statements about bioavailability are true except the question contains except. Please read it out. So it is a proportion of unchanged drug that reaches the systemic circulation. Yes, of course it is true. It is of orally administered drug can be calculated by comparing area under curve AUC after oral and IV administration. Yes, it is also true. Low bioavailability is always due to poor absorption. No, there are two reasons for low bioavailability. Low bioavailability, two reasons. One is poor absorption. Second is first pass metabolism. So it is not always necessarily due to poor absorption. It can be due to first pass metabolism also. So this option is incorrect. And bioavailability can be determined from plasma concentration or urinary excretion data. Yes, this is also correct. So incorrect among them is C. So C is the answer because except is asked on the question. So that is how you have to approach it. Next question. Again, based on the same concept, What does plasma concentration versus time graph indicate? So plasma concentration on the x-axis and time on the y-axis. If I make a graph, what does this indicate? So area under this curve, AUC, indicate bioavailability. So the correct answer is D. So many MCQs can be there on the based on this bioavailability. This is the next most recent question. Please try and attempt, give an attempt. So after oral administration, the fraction of the drug that reaches systemic circulation in unchanged form after oral administration, what the term is known as. So that is the definition of bioavailability. Correct answer is C. So don't get confused. अभी एक ही topic चल रहा है तो all are correct. लेकिन जब सब पढ़ लोगे तो you will get confused. So that is the thing. 100% bioavailability is seen in which route? Oral route, rectal route, intravenous route, or subcutaneous route? Very easy. Yes. The most of you are correct. The correct answer here is B. 100% only one route, that is IV. Rest all will have less than 100%. So I have already taught you. So 100% only IV. Rest all routes have less than 100% bioavailability. Not 100. Next concept, based on prodrug. Many questions come from prodrug in pharmacokinetics. So which of the following is a prodrug? Yes, any of you. The four options are neostigmine, captopril, enalapril, and esmolol. Which of the following is a prodrug? Any one of you? Yes, the correct answer here is B. So you have to learn the mnemonic for prodrug. I will give you the mnemonic. I will give you all mnemonics of pharma. Just attend this series. You can't afford to miss the series if you are a NEET PG candidate. So correct answer here is B. So this is the mnemonic for prodrugs. What are prodrugs, by the way? Prodrugs are the drugs which are inactive externally, and once we will take it, they will go inside the body and they will become active inside the body. Externally they are inactive. They will become active after going inside the body. That's why known as prodrugs. After going the body, they will convert into drugs. So what is the mnemonic? Give me a list of prodrugs. So the mnemonic is this: all prefer doing MD in clinical subject. So I will tell you one by one. All ka A is for ACE inhibitors. So all ACE inhibitors have pril except two ACE inhibitors, captopril and lisinopril. These are not prodrugs. Apart from it, all ACE inhibitors are prodrugs. You have to learn the exceptions. So enalapril, ramapril, many prils are there. All of them are prodrugs except captopril and lisinopril. Very important MCQ. Prefer ka P is prednisolone, proton pump inhibitors, and proguanil. 3P are there. Doing ka D is dipivefrin. You know what is dipivefrin. M is standing for three things: mercaptopurine, methyl dopa, and minoxidil. D is standing for levodopa ka D. Levodopa mein D. I is irinotecan. C stands for three things: cyclophosphamide, clopidogrel, and carbamazole. S, subjects ka S stands for sulfasalazine. It is an antibiotic, you know. So you know this is the list. You have to say it again. So you have to learn this mnemonic and say the full form. Tell this full form to your best friend and you will be able to learn it. इसको बोल के याद करो. किसी को भी सुना दो. One more question on prodrug. Let's try it. You know the mnemonic now. Let's see कौन correct है. Which of the following is a prodrug? Which of the following is a prodrug? See the mnemonic. All. What is the mnemonic? All prefer doing MD in clinical subjects. See the options: ampicillin, captopril, levodopa, and phenytoin. Now two options are confusing here. Pril. So all pril are prodrugs except captopril and lisinopril. Captopril is not a prodrug. So ये answer नहीं है. Levodopa का D is there. Can you see? Doing MD का D जो है वो levodopa. Dopa है dopa. So correct answer here is C. Phenytoin is not there in the list. Ampicillin is not there. P phenytoin नहीं था. देखो, there is no phenytoin. Carbamazepine is there. Both of them are anti-epileptic. लेकिन phenytoin नहीं है. Ampicillin भी नहीं है. sulfasalazine है. Correct answer here is C. Have you got it? So this is how many questions come from this concept also. So that was the trailer. So if you like the concept, kindly let me know. We will take more sessions on it. Thank you very much. And if you want more MCQs, so the recordings are already available. The recordings, where they are not available on YouTube, they are available on Unacademy Learners app. It is available for free. So why don't you do one thing? Go to the Play Store and install Unacademy Learners app from the Play Store. Go to the NEET PG category. After going into the category, search my name. My name is Dr.Priyanka Sachdev. Search this name. You will find my name. Go in my profile link. There is a profile link given. Click on it. Follow my profile link. You will get all my recordings. So many MCQs, past year MCQs and new MCQs are discussed there. You can watch the recordings for free. It is free, but you will require a code to unlock it. So remember the code. It is Sachdev10, SACHDEV. Sachdev is my surname. Dr. Priyanka Sachdev. Sachdev10 is the code without space. So just use this code and watch all the recordings for free. Please do it now only. Otherwise, what you can do, if you want other recordings of other educators also, after installing the app, go to the NEET PG category. There are two type of classes, free and paid. Free classes are known as special classes. These are better than YouTube classes because these are more interactive. Poll option is there, so you know your real-time ranking. Raise a hand option is there. You will never miss the class. You will get notification. The most important, you will get PDF of the notes. If you get this PDF also, it is available there. So go on the app and search it. You will find the PDF. You can attend the class anywhere, anytime. Now about the paid subscription, it is of two types: Plus and Iconic. In Plus subscription, you will get access to live and recorded lectures of the Unacademy from India's top educators, along with live tests and quizzes, along with question bank. And in Iconic subscription, along with Unacademy, you will get access to prep letter recorded lectures also. My new batch is coming on the paid platform, that is Plus platform, from 18th of August. It is already there on 18th of August, target next 2023. So I highly recommend all the next experience to join this batch. We will teach you in an integrated new way, not the conventional subject-wise manner. We will teach you integrated system-wise manner. These 4 batches are already available on the Plus platform for FMG students, for next students, and for NEET PG 2 batches are there. So you can take advantage of these batches also. There is NEET PG 1 month package available. The price is only 4,500, and if you apply the code Sachdev10, you will get additional 10% discount on it. So in the last few days of preparation, please take the benefit of it and book your seat in NEET PG results. So we will help you in achieving your rank. Book your rank there. So we will help you in your preparation. So please take the opportunity and take this 1 month package. Use the code Sachdev10. And 25,000 clinical questions are available in the app. So do practice. 2 last offers. If you are taking 1 year subscription, you will get 2 months extra. If you are taking 4 year subscription, the price is very nominal. It is 60,000 for the Plus and 75,000 for the Iconic. These are various plans available for the Plus, various plans available for the Iconic. In Plus, plans are starting from 2 months and till 4 years. In Iconic, plans are starting from 12 months till 4 years. Price is visible to you. You can convert it into monthly installment also. 1,200 for the 4 years in Plus, 1,400 for 4 years in Iconic. Longer the plan, cheaper it is. So whatever is the best plan for you, you can take it. The code is Sachdev10. Whatever plan you are selecting out of them, Plus, Iconic, 1 month, 4 year, apply the code Sachdev, SACHDEV, Sachdev10. You will get additional maximum discount on it. So don't forget the code. See you. If you want it for free, I'm launching a scholarship test. That is on 22nd August, Sunday, 11 a.m. 50 questions from systemic pathology. Winners will get free subscriptions of Plus. So please try your luck. Again, the code is same, Sachdev10 for the test. If you have any doubt, take the snapshot, post it to us. We will answer you. Please join our Telegram channel, Let's Crack NEET PG, and for getting notification. Follow my profile link. Thank you. Study hard. Bye-bye.